HIV test uptake and ART initiation rates among adolescent girls and young women enrolled to the DREAMS program of Zimbabwe. My name is Fungai Mudzengerere. My presentation outline is as follows. I will give a background, aim and the objectives, methods, results, conclusion, and recommendations. Background. Adolescent girls and young women are disproportionately affected by HIV as compared to their male counterparts. And in sub-Saharan Africa, HIV accounts for 2/3 of new HIV infections among adolescent girls and young women. And what's worrying is the prevalence of teenage pregnancy, which is pegged at 19.3% in sub-Saharan Africa. Gender-based violence is also a major concern, with 1 in 3 women experiencing gender-based violence worldwide. And GBV has resulted in adolescent girls and young women contracting HIV as they fail to negotiate for safe sex. I am going to give the overview of the DREAMS program. Zimbabwe, among other countries, started implementing the DREAMS program in 2015. And the DREAMS program is aimed at reducing HIV through the referral system. Also among the package of the DREAMS program include the GBV response, educational assistance, economic strengthening, social asset building, and there is layering of services through different partners. And the partners actually refer adolescent girls and young women so that they access services, and there is a referral completion process which is actually tracked to make sure that the services are actually accessed by the adolescent girls and young women. Aims and objectives of the study. The aim is to assess HIV testing services uptake, positivity rate, and ART initiation rate among adolescent girls and young women referred from the community. And the objectives are as follows: to determine the proportion of adolescent girls and young women who accessed HIV testing services after referral, to assess adolescent girls and young women who tested positive for HIV among those who accessed HIV testing services, then to find out the percentage of adolescent girls and young women initiated on ART among those diagnosed HIV positive. Methods. We conducted a retrospective cohort study, and we used routinely collected program data for adolescent girls and young women who were referred for HIV testing services between January and December 2018. The study was conducted in DREAM-supported districts of Zimbabwe, which are Mazowe, Makoni, Mutare, Chipinge, Gweru, and Bulawayo. Data was extracted into Microsoft Excel and imported into Stata for analysis. Results. Of the 5,569 adolescent girls and young women who were referred, 82.8% underwent for HIV testing. And for those, 7.3% got tested HIV positive. And for those who tested HIV positive, 78.9% were initiated on ART. The median duration from referral to accessing HIV testing services was 18 days, while the duration from diagnosis to initiation of ART was 4 days. Most single women, adolescent girls and young women actually underwent for HIV testing services. And the study also found out that more adolescent girls and young women referred to public health facilities were initiated on ART. Conclusion and recommendations. The study found out high levels of HIV testing uptake and ART initiation rates among adolescent girls and young women enrolled to the DREAMS program. And the study recommends scaling up the referral approaches to linkage HIV care for improving diagnosis and treatment of adolescent girls and young women. However, strategies should be adopted to shorten delays from community referral to HIV care linkages. Then there is need to improve ART initiation rates among adolescent girls and young women. Thank you.